Here with the great Dr. Jenny from North Carolina. Thank you for joining us. And
Hi.
so, doctors, when we look at this case, you see that the lower left lateral incisor is very lingual. And so the question that was posed was, should we overcorrect when we are moving this tooth buccally? And when is overcorrection appropriate and when is it not appropriate? The question that Dr. Jenny just asked me, which prompted me to record this, was an excellent question, which was, um, when we overcorrect, what does that even mean? Does that mean that we're not going to fully express the aligner? Or does it mean that we're building an overcorrection and then we intend to stop short of the end of the aligners and sort of check in on it? That's a really important question. So the answer is we don't do the second thing. Stopping short of the aligner and checking in on it presents an administrative burden on our office that we're going to have a hard time keeping track of once we get really busy with this. So we want everything to keep simple and smooth. And so when we say overcorrect, we mean built in overcorrection that we know the aligner will not fully express. That's really an important point. So, in the case of this particular tooth, the way we had it previously was more out there, right? More buccal. Okay. Um, so the lower left incisor was pretty much out here as the tooth movements. And when you click on the tooth, you see how far buccal it was. Right now it's 5.6 buccal, which is okay. As we always say, it's not moving 5.6 millimeters off of buccal bone, as you see over here. It's moving 5.6 millimeters from its current position into buccal bone. That's okay. But the way we had this case before, it was moving like 7+ millimeters from its original position. And so I think it was a couple of millimeters outside of buccal bone. So that prompted Dr. Jenny to ask, well, are we going to be okay with that overcorrection? And the answer is that overcorrection we are not going to be okay with. But this case is great because there is an overcorrection here that we are okay with. And so I want to sort of highlight the difference, and that has to do with the deep bite. So when you look at the case like this, the bite was deep. And so we say very often that we overcorrect for deep bites in particular with aligners. And the reason we overcorrect with deep bites is twofold. Number one, aligners have a tendency to create an anterior interference in the first place, which is to say they are intruding posteriorly. And so anteriorly, you want to make sure that that overcorrection, maybe it's not the right word, but that compensation is going to initially include, right, an expectation of um, intrusion anteriorly to avoid getting anterior interference. So when we have the dual threat of the natural tendency of the appliance to have anterior interference and the initial presentation of a deep bite, we are very comfortable with having edge to edge or even like within 1 millimeter of an open bite like this as a result, as in our final clinch check, knowing very well a couple of things. First of all, we are talking about early pediatric aligners. So this is not something that we're doing with adults, right? Most of our course really ends up highlighting how different really aligners are. And as we collaborate and we have this peer-to-peer interaction, we learn more and more how different our mechanics are than mechanics for teens and adults. We put teens and adults in one group. It's just adult dentition behaves very differently. It's a different mechanic than the early mixed dentition. So in our early mixed dentition, and I apologize, but I have to do this because I have to make this fully symmetrical even as we talk because I can't even look at it until it's perfect. But um, this is an overcorrection of sorts. But this one we build in knowing that certain things don't look exactly the way they do on a clinch check, and the anterior vertical is one of those things. And so we build in overcorrection when it comes to anterior deep bite. But when it comes to buccal movement, we're very careful about the biological boundary of the lower anterior buccal bone. And therefore, that's actually a movement that probably will express in the aligner, such that when you finish these, so of course, because it's early mixed dentition, you're going to refine whatever it is that you get anyway and rescan. But we give all the boxes. We don't say stop at any point. We don't even need to necessarily check at any point. This is safe because it's not coming out of buccal bone on the lower anterior. And intrusion is always safe because we're always giving a safe therapeutic force and it's going into bone. It's not coming out of any biological boundaries. Even if it were 8 millimeters of intrusion, assuming that the roots were properly formed, that would be safe too. So definitely yes, overcorrection on the intrusion anteriorly, but no overcorrection on the buccal on the buccal movement over there on the ladder. So excellent question, and I'm so glad you asked it because that's a very important point for all of us to recognize.
Okay, and then just to follow up from there, so laterals, like if we're usually doing, 8, 9 year olds and their laterals are just in, typically we're not going to intrude them anyway because they're just now coming in. But if we shouldn't, right? We shouldn't touch those anyway because their roots are not, they're probably just forming. They had just,
So yeah, so Jenny's pointing out a really important point, which is very typically our cases are like Dr. Manal Ibrahim's case. Let's see if I find it quickly. But we're seeing this age all day, right? This kind of thing, right? Where
yeah,
we need the laterals helped to come in. So when we're seeing those kinds of cases, that is a situation where we are not intruding these and we're not going to touch these laterals too much. That's usually works to our advantage because the fact of the matter is we're usually looking to extrude laterals, which is a very difficult movement with aligners. So we let those guys fly on their own until we put attachments on them for detailing, because without attachments, we have no shot at detailing those. Um, there is the mechanics for laterals that's very unique to them in particular, as far as that's concerned. So you're right. What I really when I say intrusion, it's more often going to be bringing the central incisors up to the level of the laterals, and that's
right.
always going to be a much more efficient and predictable movement than bringing the laterals down to the central incisors. So we do a lot of central incisor intrusion. So thank you
And
so much
the
for that
and the
question.
kids with laterals that a lot of times they're buccally flared. Those type of rotations are okay, even though the root's not fully formed from them for them, right?
So yeah, so rotation, you're saying any movement on laterals at all, are we concerned about that?
Yeah, yeah, I wanted to make sure.
So I think that that's a really important point. We want to really obviously first do no harm. We don't get aggressive with laterals until we know that the roots are more formed and they're in.
Right.
So to your point, it's sort of like segmental mentalities and prioritization as the case progresses. So at this stage that you see in front of you, it's just all about making room, opening the arch, anterior development, let the teeth erupt. Once the
Yep.
teeth are erupted, they're healthy, they're in place, the roots are more out of danger. That's when we get. So it's really more for a later stage. And that's a really important point because even though we speak about sash attachments and being deliberate with laterals, we do not want to be too aggressive early. So again, it's another contrast between early mixed dentition and adult dentition. In adult dentition, you want all the mechanics in place. You want to reduce refinements. You want everything to be sort of ahead of time as far
Hmm.
as treatment planning. Here, we're very much going step by step and prioritizing each at each point along the way. So first, it's arch development, let things erupt. Then once things are looking so much better and they look dramatically better pretty quickly, now we're getting and starting to introduce detailing step by step as we do our 5 or 6 refinements, so to speak, which we're not afraid to do because that's not really refinement. It may be called that, but it's the guiding teeth into place. So excellent observations. I'm happy to be able to share that.